Dr. Robert Murphy, a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor.
Hey, good morning.
So the big headline of the week is the Wuhan lab. And early on, we talked about conspiracy theories, but that wasn't about the possibility of something happening in the lab. Can you expand on what's going on here, what they'll look at to try and find answers?
Well, the big question is, well, there's several big questions. One is, where did this virus come from? And the feeling up until now, or the data up until now, it's more than just a feeling, is that this naturally occurred from animals and jumped into humans. Whether it was in the marketplace or some other place, we don't know. So then there's this conspiracy theory that it came from the laboratory. Now, in the laboratory, it could have been a worker who got infected on the outside and got into the inside, infected maybe some other people, and maybe, possibly contaminated some of the specimens there. It could be that a worker got infected by a contaminated animal, an infected animal in the lab, and then took it out of the lab and infected the.
But the conspiracy theory isn't that it happened in a lab; it's that it was kind of used as a bioweapon. That, to me, was the conspiracy theory.
I was getting to
that.
That's
Wait
the lab
for it.
That they're working in the lab to actually make a nastier virus. There is a process that is done in certain laboratories to actually then make a nastier virus and then learn how to kill that virus. That is the least likely of the scenarios. So you have all that stuff going on. So the data from the 14 persons who came from the WHO was rather limited, but nothing really big came out of that. And now there's evidence that some of these workers in the lab got very sick in the autumn. We don't know exactly what date. We don't even know if they ended up in the hospital. We don't know if they even had COVID. They could have had. There was an influenza outbreak also in the fall in Wuhan. So all that stuff is just spinning this conspiracy theory thing. It doesn't change anything to do with the pandemic right now. But it is important to find out what was the origin. Where was is it a market? Is it animals? What is the deal? So I mean, the general question is a good one. But the conspiracy theories about constructing their own virus seem really implausible.
Dr. Murphy, we've got Memorial Day travel here. We saw the shots live from O'Hare Airport. I know they still have mask mandates in place at O'Hare, at Midway, but a lot of places you don't have to wear a mask anymore. People are vaccinated. Are you worried that numbers could rise here after Memorial Day?
Well, we'll see. Wearing the mask is what we've been doing all along, but now the airports and the airplanes are pretty crowded. That's a high-risk situation, but I think we've shown that that's not going to be a high-risk place if all the masking, is done appropriately, which it looks like from just the news reel you showed, looked like everybody's wearing a mask and doing the right thing. So probably it's not going to be bad. I think what is the risky thing now is what's going to happen in the fall, when people actually go back inside and you have big groups of people who aren't wearing a mask inside. Are we going to have a peak in the fall?
All right, here are the questions. If you don't get a vaccination shot now, will you be able to get a booster shot when they are available?
Well, yeah, you don't get a booster until you actually had the first 2 shots. So if you don't get it now and they come up with a revised vaccine, that works better against some of these variants of concern, you would have to still take the 2 shots. And when you decide to take when everyone else is getting a booster, you're going to take your 2 shots, and then you get a booster the next year.
Another question here. After you get your vaccine, should you have an antibody blood test done? A friend had it done. She had no antibodies. My daughter had it done, and she had them. What does the test really do?
Yeah, this is a good question because, excuse me, the antibody test that you order commercially is not the same antibody that is produced by the vaccine. Sometimes it cross-reacts, but sometimes it doesn't. It's the commercial antibody test you can just order in a doctor's office is not helpful. It is not recommended that you get one of those antibody tests after the vaccines. The vaccines have basically 100% activity. The big question, though, is, and we don't have an answer, is what if you're immunocompromised? What if you're taking steroids or you have an underlying cancer or some inflammatory disease and you don't know if your body makes the antibody to the vaccine? That's the big question, and we don't have an answer for that because the commercial antibodies are not going to tell you the answer.
Dr. Murphy, thank you for joining us as always, not only this week, but in the pedicab as well. If you have a question for Dr. Murphy, you can head to our morning Facebook page, post it there. We will talk to him again on Tuesday. We gave you Monday off.
Yeah, Monday I get up.
Thank you, Dr. Murphy.
Hey, Paul.